What is appendicitis? And by the way, where is the appendix located in your body? And what does the appendix do? What are the treatments for appendicitis? And what are the symptoms? Guys, I'm going to answer this and more. It's good to see you. I'm Dr. Jen Caudle. We are covering what you need to know about appendicitis. Interestingly enough, appendicitis is actually the most common reason that people need emergency belly surgery around the world. What is appendicitis? Well, it's when the appendix becomes inflamed and infected. Okay, so if the appendix gets blocked, it starts swelling, fills with bacteria, it can become very painful, it's inflamed, it's infected. This is generally what we think about as appendicitis. And the thing about it is it's very potentially serious. If left untreated, the appendix in the form of appendicitis, like when it's inflamed, etc., it can actually burst or rupture. The problem with this, if that happens, is if the appendix bursts or ruptures from the inflammation, it can actually spread infection throughout your body, which can be very, very dangerous. And this is why appendicitis is generally considered a medical emergency that we need to treat right away. Like as a doctor, a family doctor, we do not, and all doctors, we do not play around with potential appendicitis. We have to treat it and make sure you are safe. What is it? Where is it? The appendix is a small, kind of like finger-shaped pouch. It's about 3 to 4 inches long, like the size of your pinky finger. It's attached to the first part of your large intestine called the cecum and the lower right side of your belly. So basically, it's kind of like if you imagine a line from your belly button to your right hip bone, the appendix sits about 1/3 of the way along that line. So hopefully that gives you a little bit of an idea. And that's why when people have appendicitis, like the inflammation, infection of the appendix, the pain is generally in the right lower part of the belly, okay? When we talk about abdominal pain or belly pain, doctors, one of the first things we want to know is which part of the belly is it? Because it often gives us an idea of what could be going on because you have different organs in different places. What does the appendix do? For a long time, we actually thought it was useless. We just thought that it like kind of did nothing. But we've learned a little bit over the years. The appendix might actually be helpful. First of all, it does contain immune tissue, okay, that helps our body fight infection. So like, ding, 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 of course, that is important, especially when we're young. And then second, the appendix almost acts like a safe house for the good bacteria that live in our gut, which is also a good thing. It's kind of interesting, but like think about like this, like if you get like a bad stomach bug or stomach virus or whatever that wipes out the healthy bacteria in your intestines, the appendix can actually help repopulate your gut with good bacteria. Interesting, eh? If you're worried, oh my gosh, I've had my appendix out, I'm not going to be okay. No, 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 no. Even though the appendix does these things, those who've had their appendix out and have them removed live perfectly healthy lives. Okay, your body can function just fine without the appendix. So I don't want you to think that like, oh my gosh, right? So as we discussed, when appendicitis happens, the appendix becomes inflamed, it becomes infected. Oftentimes the opening of the appendix can be blocked. And when that blockage occurs, mucus can build up, bacteria multiply. And again, that's sort of the inflamed, infected, swollen aspect that we see of the appendix in the state of appendicitis. And if you're saying, well, gosh, what causes this blockage? Like, why would this even happen? Hardened stool can sometimes do it. Pieces of like hardened poop can sometimes do it. Oh, and by the way, before I tell you the other things, I don't want you to be super nervous about this, okay? Like appendicitis oftentimes like just happens when it happens. I don't want you to feel like you're doing something wrong or, you can absolutely bring this on because it's not always and usually is not in your control. Let me just say that. The other thing that can block the appendix is swollen lymph tissue, like if you have an infection. Less commonly, it can be blocked by like a foreign object, parasites, even tumors, things like that. You see, like this is not something you're going to be like, okay, let me do X, Y, and Z so I can cause appendicitis. Or, oh my gosh, I did A, B, and C and I'm going to get appendicitis. No, like it's something that just kind of like, bing, just sometimes happens in some people. It's most common in teenagers and young adults in their 20s, but it can happen honestly at any age, okay? And it's slightly more common in men than in women. So there's sort of a classic pattern of pain. And let's first start talking about location, because remember I told you, if you have belly pain, where in your belly you have the pain means a lot to us doctors, okay? So the pain often starts, remember the appendix is the right lower quadrant, but the pain often starts around the belly button. And then as the pain gets worse, it can kind of move to the right lower side of the belly. It tends to become sharper, more intense over a number of hours. Again, this sort of right lower quadrant pain is something like if anybody says they have pain in their right lower quadrant, the first thing we have to make sure it is not is appendicitis, okay? But when you have this pain, people who have appendicitis, like they feel unwell. They feel sick, okay? You don't feel like eating. You may feel nauseous. Sometimes there's vomiting along with it. Sometimes there's like low grade fever. Sometimes like the pain often can get worse like when you walk, when you cough or make sudden movements. So sometimes when people have things like, appendicitis, they don't want to move at all because it can cause so much pain. And the bottom line here is that any pain that you have, right? Any pain that's unusual, any pain that you have, right lower quadrant, or elsewhere needs to be evaluated promptly by your doctor. But in particular, when we think about appendicitis, we are thinking about typically the right lower quadrant. But do not say to yourself, oh, Dr. Jen says it's the right lower quadrant, so if you have pain here, it's not a big deal. No, you need to seek emergency care if you have any unusual pain, severe pains, fever, chill, nausea, vomiting, like severe symptoms, no matter what they are. Don't decide on your own what it is and what it is not. Now, back to appendicitis. The good news is it's very treatable. Okay, so how do we treat it? Surgery is a way. I'd say probably most people still get surgery to remove the appendix. Okay, it tends to be the standard, a standard treatment rather. And yeah, it's one of the reasons why knowing when someone has appendicitis is really important, because oftentimes they get surgery. Now, for some people with uncomplicated appendicitis, meaning like the appendix hasn't ruptured or like there's no abscess or whatever, for some people, antibiotics alone may be an option. Many people treated with antibiotics get better without needing surgery, but there are some people treated with antibiotics only who will need to have surgery. The treatment that you need is going to be dependent on your symptoms, who you are, what's going on, and what your doctor feels. Okay, so that's why emergency treatment is very, very important. If you think you have appendicitis, this is not an invitation to call your doctor and be like, hey, can you call me in some antibiotics? No, that's a medical emergency. You must go to the hospital ASAP, okay? But just know that there is treatment for this. I want to know, have you ever had appendicitis? Write this in the comments. Was this video helpful? Please share this video, by the way, with other people. Just know that if you do have appendicitis, there are things we can do about it. And as always, just make sure you listen to your body. Even though I'm not your doctor, make sure that you seek out medical care right away if this or anything else unusual or severe, or even not severe, happens to you. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on health stuff. So please make sure you subscribe to my YouTube channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, all the good things. Also, please sign up for my free health newsletter at drjencaudle.com.